Okay, so it's 11:30 and we'll get going. Good morning everyone, bienvenue tout le monde. Mon nom c'est Debbie Magwood, je suis la directrice générale du Centre de bien-être de l'Ouest de l'île pour les personnes atteintes de cancer. So I am the executive director of the West Island Cancer Wellness Center, and I'm going to be the person who's going to be doing a little bit of an interview with our wonderful guests today. For your information, if you're new to the Zoom world, the best way to view this presentation is in speaker view. So to do that, you need to change your view. It's either in the left or the right top corner, so that when you're in speaker view, I will be, as I'm speaking, the main view that you will see. You won't see a bunch of little boxes, you'll just see the speaker who is speaking. So I kindly ask you to make that change, and that'll make the presentation a little bit easier to view. We're going to be doing sort of a question period with our guest at the beginning, and then we will be having a bit of an exercise that Dr. Rutledge will be walking us through. If at any point you have any questions, you can use the little chat button on the bottom. So you click chat and you chat to me, which is connection@WICWC. And if I can get your questions in the time that we have, I'll gladly do that. So without further ado, I'd like to introduce to you our wonderful guest for today, and that is Dr. Rob Rutledge. Rob is a radiation oncologist in Halifax, Nova Scotia, specializing in breast, prostate, and pediatric cancers. He is also an associate professor in the Faculty of Medicine at Dalhousie University. In 1999, Rob co-created the Skills for Healing Cancer Weekend Retreats. These weekends support groups and teaches them powerful and integrative approach to the cancer diagnosis and ways to heal at levels of body, mind, and spirit. To date, more than 2,000 people have attended 60+ retreats in over 30 cities across Canada and abroad. Rob is the CEO and chair of the Healing and Cancer Foundation, registered charity that freely offers educational videos, documentaries, and webcasting seminars. He is a co-author of a book called The Healing Circle, which captures the teachings and inspirational stories from the weekend retreats. Rob also received the Cancer Care Nova Scotia Award of Excellence in Patient Care, and Doctors Nova Scotia presented him with a Health Promotion Award in recognition of his contributions to physicians' health and health promotion in cancer care. We are phenomenally honored today to have Rob with us. I can speak to those retreats because you've come and given a couple of them with us over at the Cancer Wellness Center. So welcome, Rob.
Merci beaucoup, Debbie, et bienvenue tout le monde. It's such a pleasure. I just absolutely love working with great organizations like the West Island Cancer Wellness Center, and with people who are actually willing in the middle of the day to come and listen to a podcast, or who are watching this film after the fact. I mean, the fact is people can make a real difference in their health by empowering themselves. And all that program that you're doing at the Wellness Center there, that's very impressive. So my hat's off, and I'm like super excited to be with you as well, Debbie. Thank you.
Yeah. Amazing.
Yeah.
So Rob, the first question we'd like to ask to you is, you're an oncologist. So how does an oncologist transition into including integrative care or cancer wellness into his life?
Yeah, I don't think I chose it. I think it chose me. I think I'm not really in control of these things. And I think I would have been very, very unhappy had I not followed my heart and what spirit, or however you want to say it, was guiding me to do. It actually happened in the 1980s when I was going to medical school. And at that time, University of Toronto, very hard-nosed science. it's like knowledge, make the diagnosis, apply the treatment. It was like, just like physical care. And yes, there was some bedside manner type stuff, but really it was pretty dry spiritually. And then, the universe conspired and the book kind of fell off the shelf. And the book was called Love, Medicine, and Miracles by Dr. Bernie Siegel. And it talked about this whole other element of, Bernie talked about his exceptional cancer patients, the people that did extremely well, who far outlived their doctor's predictions, who got through difficult treatments, and it's like my heart knew I just wanted to be, to empower people, body, mind, and spirit. I knew I wanted to run support groups from that moment on. And I just feel so incredibly blessed to have that opportunity and to make a difference in people's lives, because that's the truth. You can actually make a real difference in terms of your health and your happiness by what you do beyond the medical system.
So from your perspective, what then is integrative medicine? What is, as we call it, cancer wellness? What's your definition of that?
Yeah, so it's such an important concept because they kind of think about it maybe like a train going down a train track, and you need both tracks for the train to run well. And that's my perspective. Some people may think they can just go on one track and just do the medical stuff, or some people could think, oh, well, just going to do the alternative stuff or the complementary stuff. But I really think the train runs well when you maximize. I mean, medical science, has, incredible research, incredible capacity. I think we need to be smart as to how we access and get the best care from the medical system. And that's a 20-minute talk by itself, how to advocate for yourself, et cetera, et cetera. But really, it's the marriage. Integrative medicine is the marriage of those two sides. It's like the combination. And when you take care of yourself, body, mind, and spirit, it really supports the medical side of it. And, the problem is the medical system often just thinks about physical care when in fact you can actually change your physiology, change the soup in which the cancer cells were growing through the kind of physical side. We're talking like stress reduction, mind, and gratitude. And then there's a whole kind of spiritual level that has a huge influence. But doing those two together really maximizes the chance of recovery, the chance of healing from a cancer diagnosis.
You're definitely preaching to the converted here, let me tell you. But do you find that most of the medical community follows that model and believes in that model?
Yeah, I think the younger physicians are the more enlightened physicians. And as our society evolves, as our society matures, the younger physicians will be better and better and better at doing that. The way I think about this is the medical system is a very complicated beast. It spends 98% of its time on physical care, and that has its place. The physicians in Canada, the physicians in Montreal are following the international guidelines. They're going to conferences. They're trying to make sure the physical care is the best care possible within, their resources. So we as individuals, if we have a cancer diagnosis, we have to do the other piece. That's why the wellness center comes into this, right? And it's a huge learning. I mean, you need to talk to people. You need to get the advice from experts. There's lots of experts on this side as well that you can tap into in terms of the science of what makes sense to you and tapping into your intuition. But it doesn't help in some sense to be judgmental of the medical system, just that we have to recognize that they're only providing one piece of the pie and that we need to create the other pieces of our pie.
Right. I think that's an excellent point, that the resources are available out there for most of us to tap into, and that the medical community is focusing so wholeheartedly on combating the predator, the disease.
Yes.
That sometimes, the rest of the care we have to feel empowered to take care of it ourselves.
Yeah. And not to say that that's easy, right? This is,
Right.
we all need to learn, we all need to grow, we all need to kind of understand. And that's the power of the Wellness Center, is that you get to connect with the experts who are there, and you get to connect with other people who've had a cancer diagnosis who can also support us. And, we can learn a lot from each other. There's a real power of connection. The other part of this for a lot of people is that people feel alone. They feel isolated especially when they first get a cancer diagnosis. And that's also the power of the Wellness Center, and one of the pieces of the pie of the social connection.
Right.
Yeah.
You touched on it a little bit earlier, Rob, about the whole, the scientific proof or the evidence that supports cancer wellness or integrative care. Can you maybe elaborate a little bit more on that for us?
Sure. Yeah. So first of all, there's no guarantees, right? So even if you do everything perfectly, even if you follow all the attributes of the remarkable cancer survivors, it's not to say that you're 100% going to be cured of cancer. But we talk about, even within the medical system, we talk about, if you do this treatment, you increase your chance of cure, right? And so in the same way, we can look at it just even from a physical perspective. There are certain cancers that we know respond to lifestyle changes. And so you think about it from your perspective. If your type of cancer, if there's known risk factors, so if you know that your cancer, smoking was a risk factor, then you want to stop smoking. If you know that inactivity or a fatty diet or, these other things were a risk factor in terms of getting that type of cancer, then you want to stop that. And also if you know that if you knew that your cancer is, less risk if you exercise, if you have a healthy fat diet, if you maintain a reasonable weight, if you, take care of your kind of sleep habits, if you know those activities decrease the risk of getting that kind of diagnosis, then you want to adopt those later on. And the other way I kind of try to explain this is, cancer develops when the normal cells turn into abnormal cells, turn into cancer cells. So it's kind of like a progression over time, and you kind of get hits on those cells over the years and decades. And so you're going from normal cells to cancer cells, but it doesn't just stop there. You can be going from slow growing cancer cells to fast growing cancer cells. And you don't want to change. If you have cancer cells in your body, you don't want to have more hits, more changes, more mutations on them. And that's why the physical activity really makes a difference. So the physical stuff. The second thing is there's really interesting science around inflammation. So you think about, your skin gets a sunburn, right? And you get kind of red and inflamed and sore. Well, your whole body can have inflammation. So that could be hitting your joints, could be hitting your gut, but it also potentially hits each and every cell, including the cancer cells. And you don't want that inflammation to irritate the tissues further. The other thing is when there's inflammation in your body, your immune system doesn't work as well, right? And again, by taking care of yourself. So I'm starting to talk about stress reduction, not only the healthy diet, but if you can decrease your stress, if you can find meaning in this world, then there's less inflammation, and then your body's natural capacity to fight off cancer or to heal itself is unleashed. And that happens both, I think, from I'm talking about a physical perspective, but I also think that there's something that's beyond what we understand, maybe call it metaphysical or a consciousness level. When you truly take care of yourself, when you come listen to this podcast, you're watching this on video, you're sending a message to yourself about healing and wholeness, that you want to get better, and something metaphysical helps with that healing process. I could riff for another 20 minutes just on this question. So anyways, thanks, Debbie. Yeah, lots of ways to heal.
It was a great response, and I can only imagine how you're holding yourself back a little bit because it's such a small timeline that we have together.
Yes. Yeah.
But again, to the audience, if there's anything that we're talking about or any questions that pop up, please feel free to go down to the chat button and shoot me out a question, and I'll be sure to try to ask it of Rob.
Great, thank you.
So I guess what intrigued me a lot, and had I not been interviewing you today, I would have definitely came and sat in on this talk, because you addressed it as the remarkable cancer survivor.
Mm-hmm.
Can you just tell us what are the attributes of a remarkable cancer
Yes.
survivor and how do we all become one?
Right. Yes. Yes. So this is my 30-year journey now to try to understand this. So it started in medical school, reading Love, Medicine, Miracles by Dr. Bernie Siegel. So he was a cancer surgeon. He noticed that there were certain attributes of the remarkable cancer survivors. He called them exceptional cancer survivors. And I take exception to that because I think we all have the capacity to really heal ourselves. But essentially, it was this idea of, self-love, self-care, like being proactive. It was like letting go of the, attachment to the future, which is kind of it sounds like a paradox. Like, yes, I'd like each of you to be cured of your cancer, but the remarkable cancer survivors didn't put their energies in the things they could not control. They put their energies in the things that they could control, which is, how they express their spirit, their love in this world. So when we get ourselves into that space, that, I think that has an effect on our physiology, and it definitely has an effect on our neurochemistry and so on. So Bernie was the first one to kind of introduce his exceptional cancer patients, and then to tell it as kind of a chronology then. So Dr. Alistair Cunningham, who runs the Healing Journey program in Toronto and is a research scientist at the Princess Margaret Hospital, also researched this, like which patients do better. And he actually had a study in which he was looking at people who had incurable cancer. And as a group, they all have it about a predicted average survival of 1 year. And then prospectively, meaning he looked going into the future as to how much involvement they had in their own healing journey. Were they journaling? Were they meditating? Were they joining groups? The third of the people, like they broke them into thirds, the third of the people who were the high involvement people lived on average for 3 years, whereas the low involvement people lived for the predicted 1 year. And not only that, he had two, what I would call spontaneous remissions or radical remissions, two people who were like living 20 plus years later, even though they had metastatic cancer involving bone. So again, I'm not promising this, and it happens more rarely, but there was a study in which the, people who were proactive actually did better. And lastly, just kind of flash, Dr. Kelly Turner, PhD, her book, Radical Remissions, in which she's interviewed, well, now hundreds of people who've had a spontaneous remission. And she essentially did qualitative research. So she was UC Berkeley, did qualitative research and found out it was 9 factors. She's added the 10th factor now. But here's her list of the people who've done remarkably well in terms of spontaneous remission and so on. Radically changing your diet, taking control of your health. Actually, I think those two are really linked because, how can you, change your diet and control your health? Well, you do something about it. Following your intuition, using herbs and supplements, which there was no one herb or supplement, releasing suppressed emotions, increasing positive emotions, embracing social support, deepening your spiritual connection, having strong reasons for living. And the 10th factor is actually exercise. But anyway, so now you're starting to see a pattern of the people who are proactive and willing to do the work, willing to go into the Cancer Wellness Center and like take care of themselves and make a difference in their lives. That's the starting place.
So are you saying, Rob, that people who like follow some sort of a regime that considers their emotional well-being, their spiritual well-being, and their physical well-being are more likely or have a higher probability of being able to work in conjunction to modern medicine to get to a point of a remission?
Yeah, well, I mean, we could talk about the various goals, but on average, they're more likely to get better, right? They're more likely to recover. They're more likely to heal. They definitely have better quality of life. I would say there's increased longevity there for those who are not going to be cured of their cancer. So the science is there to suggest that, we can influence it. I guess the other thing is oftentimes we think about, cure or not, or longevity or not. And I want to put the bigger context of how do you want to live your life? It's actually a more important question. So whether you've got 2 years to go or 52 years to go, would you really live your next 6 months differently? Right? And so why wouldn't we, find meaning, put our energy into our relationships, let our spirit out into the world while we're taking care of ourselves? And I think, the way I think about it is we have this incredible opportunity, this human experience. So I want to take care of my body so that my body and my brain will be in the best condition possible so I can do those most important things. It's like the purpose is to connect. The purpose is to love, and put your energy and focus there, and let that will help you. That improves your chances, but at least you're doing the most important things regardless of what's going to happen in the future. And that's a spiritual perspective. Yeah.
I'm particularly touched by what you just said, because no matter how hard some people work at eating properly and exercising regularly and meditating on a regular basis, there is still a probability that cancer will impact their life.
Right.
And more so for people who, we've experienced it many times at the center, people who were religiously attending and doing all the right things according to, to the book of, the ways of proper following the regimes, and still have succumbed to the disease.
Right.
And I think that, what you said about it, making these changes in your life isn't necessarily to prolong your life. We hope it is.
Yes.
But more importantly, it's about the quality of life.
Agreed. And I mean, it is natural to want to go for the cure. It's natural to want to go for the longevity, but it's like a trick of mind. It's the paradox is let go of that. Let go of what you can't control so that you can focus your energy here. And I think there's a physiology of the here, and the here is, I call it the physiology of love, or the physiology of connection, or whatever you value most. When you get into that state of mind, it has a profound influence at the brain level. And it also sends a signal to your body that says, I want to live. I want to get better. It's like when you go out to exercise, that first 2-3 minutes when you're first, the physical activities, this doesn't feel quite right. It's at that moment where you're really sending that signal to say, I do want to live. I do want to get better. And I've been, I continue to kind of read the science. And for instance, we know that exercise and the muscles actually release hormones into your system. And I think it's like the live hormones. It's like, first of all, there's probably hormones there that are anti-cancer by themselves. It's definitely boosting the immune system, helps your brain health, but there's actually anti-cancer properties there. So it's like the body's set up to know when you're in that space that I want to do well, then it kind of energizes you. And at the same time, Deb, I do want to kind of, riff on this idea. There are some people who have had perfect diets and they're yoga teachers and they've done everything right, and yet they get a cancer diagnosis, right? And so, or there are other people who, get a cancer diagnosis and do everything right, and then their cancer can come back. And there shouldn't be a kind of a guilt feeling like I didn't meditate hard enough, or I didn't exercise enough, et cetera, et cetera. We really need to be kind to ourselves, self-compassion, to say, I did what I felt was right at the time. And just that kind of self-compassionate piece is also healing in and of itself. Excuse me, I'm talking so much, I'm starting to cough here. So
I think that's a beautiful point.
Yeah.
I think sometimes when we get diagnosed with a disease, we're in search for the reason.
Right.
And then we lose sight of the meaning. And the idea of just letting go of the power of what you can't control, like you said, is quite profound. You know, if you have the cancer diagnosis, what can we do
Right.
to live better, to feel better, and to connect?
And to reprioritize. And again, I'm not trying to foist my philosophy or my approach on it, but I guess the point is, for all of us, we all have an opportunity. We always can start afresh. We can always start from now to say to ourselves, well, how do we want to live our lives? How do we want to live this day? What's my best self? And how can I bring that into the world? And that actually takes work. That actually, you know, this is not like just thinking that. There's brain science around the fact that you want to live more often in your frontal lobe, which is the wise and compassionate part of yourself. And so how do you do that? So to the best of your abilities, you learn how to feed yourself well, you learn how to exercise your body, you learn how to sleep as best you can, you practice a relaxation technique. All those things contribute then, and also, you know, those things maximize your kind of physical response to cancer, but it maximizes the chance that you will be in a space where you're your better self and you're your happier self, and it's your more healthy self, and your immune system works better. And, you know, it's all these things, you know, so it's a benefit of kind of practicing these things so that you can experience and manifest the highest aspect of your beingness.
Yeah, beautifully beautifully said. I think also, you know, we can't just jump to that place either. I think that there's that process of allowing yourself to be sad, to be angry, to be concerned, to you know, to have those feelings and voice those feelings, and then that actually frees you to maybe do the things that you're talking about.
Right. Thank goodness for you making that very important point, because I think that we human beings, you know, you hear this talk and think, oh, I just need to do all these things. I just need to be in this positive, loving space all the time. Well, the starting point for me is being authentic and honest, right? So when we get a cancer diagnosis, oftentimes our expectations are shattered as to how the future was going to be. And so when our expectations are lost, there's loss, and therefore we need to grieve. We need to grieve our expectations and allow those emotions to go through us. This is not just about being positive and so on, but being human and being full and, you know, sharing that with other people. So, you know, part of one of the things I said from Callie's book was releasing suppressed emotions and increasing positive emotions. I'm not saying be positive all the time. It's like create the conditions in which you're more likely to be positive and connect and be your best self, recognizing that we are human. We're going to have good moments and bad moments, and good hours and bad hours. And some days we're going to feel crappy, and some days we're going to feel happy, and that's normal. And it goes back to this idea of the kind of self-love, seeing yourself as, you know, the perfectly imperfect, or the broken yet whole human being that we all are. And, you know, when you can get into the kind of loving yourself as you are, it's like that next step up of, you know, empowering yourself, being happier. You know, stress, you could talk about stress for half an hour, right? When we're stressed and we're fighting against the reality of what's happening, that causes an extra layer of stress. That if we can, in fact, Alistair Cunningham's attributes of remarkable cancer survivors, one was authentic, meaning I recognize where I am right now. Autonomous, which meaning I'm taking action. And the third A was acceptance. So it's like being able to accept the reality for how it is, not struggling and so on, and yet being proactive in addition. It's both accepting and being proactive is the, I think, the mechanism which you're most likely to heal.
Yes, I guess you have to experience something to get to acceptance, and then to be able to, once you've got to acceptance, you could then start looking at different ways to integrate changes in your life to help you live better in whatever
Yes.
the trajectory of care or trajectory of the
Yeah.
disease is going to be.
Yeah. And as you say, the acceptance piece may not come right away, right?
Mm-hmm.
I mean, we humans grieve the loss. It takes time to accept the reality of the truth of the situation. But at some point, there's that opportunity to really accept the truth and decide, okay, well, what am I going to do with this? How am I going to respond to the circumstance? Yeah.
So our half an hour of question period has sped by. I have
Yes,
a
very
billion
much
other
so.
questions I'm sure I could ask.
Yeah.
But Rob, if you could kind of summarize what we've been talking about today before you move on to doing your beautiful exercise, could you do that for us?
Yeah. Yeah. So people have an amazing capacity. People have an amazing resilience to face whatever happens in their lives. That's the first thing. You have resilience. If you're listening to this, you have resilience. You'd surprise yourself as to how strong you are. That's the first thing. So it's there already. The second thing is you can really make a difference in your health and happiness, right? So by learning, by growing, by going to the experts, by trusting your intuition, you really can empower yourself and feel better and happier. And you can also choose to be your best self as often as you can, because we're humans. Choose to be yourself, best self, so that you can express your spirit in this world, connect with other people. Whatever you value, you can choose to do more of. And when you're in that space, I think that's the kind of ground for the miraculous change. So I'll leave it there. I give lots of summaries, but there's, it's it is a healing journey. You will continue to learn, right, guys? This is not, and that's the power of the wellness centers. You go in, you learn, you connect with other people, and hats off for you for tapping into the West Island.
Well, thank you.
Yeah.
Would you like to lead us in an exercise that sort of speaks to this whole cancer wellness or integrative care and self-care and self-love and self-compassion that you were speaking of?
Yeah, I'm very happy to do an exercise, but j'ai vu une question française. Do you want to read? Do you want me to tackle that one? Do you want me to?
How about you do your exercise, and
Great.
we'll allow other people to keep asking questions.
Great.
And we'll ask you 2 or 3 at the end, so we'll be able to catch those.
Perfect. Okay, so here is a wonderful opportunity for people to come to a deep space of relaxation and also heartfulness. So it's probably best if you can lie down in some way or form. So if you're close by to a couch or a bed, if you don't have that kind of opportunity, if you can't put a few blankets on the floor, then you can simply slump back into your chair. So it's best to do this when your body is able to completely let go and completely relax. And I like to start out with the kind of heart level. So we bring our attention back to our heart, bringing our attention into the physicality of the middle of our chest to start out with. So I'm going to take you through probably a 20-minute relaxation exercise with a little bit of visualization there. And start out with a kind of bringing your consciousness or your attention back to the physical body, the physical heart. Bring your attention to your breath now. Be very curious, a curious mind. What does it feel like to breathe? Very nice. And let's warm up the heart center now with a feeling of caring and compassion. So really, it's like you're breathing through your heart, breathing in, breathing out, but you're warming your heart now with a sense of compassion, sense of caring. And you can often do that best with bringing to mind a loved one, somebody that you deeply love, deeply care about. And it could be at a different time in your life, maybe when your kids were young, maybe when you were young. And just remember the moments of connection, deeply caring, and just as if from your heart you're breathing out the kind of radiating the sense of warmth, caring, love towards that person. Now bring to mind somebody in your life who's hurting in some way or form, or suffering, or who's in distress in some way or form. And it could be somebody who's close to you, it could be somebody you can see from a distance. And again, allow your heart to warm. Send that warm energy from your heart right into that person's heart and wish them well. Like you're saying to them, may you find healing, may you find peace. Whatever is best for you, in whatever way is that happens, just again, imagine like you got this warm healing energy in the middle of your chest, this kind of limitless, wondrous transmitter of love, always renewing itself. Now bring to mind the other people in your life that you really care for. So any family members, friends, people you know from work. And as those people come to mind, also like give them a kind of healing embrace with your heart. As the images and memories come up, it's like you're sending a warm healing energy from your heart right into their heart. Ah, I love you. I want you to be well. I want you to be happy. Now extend that warm healing energy to everybody that goes to the West Island Wellness Center. All those people, cancer diagnosis in Montreal, extend that warm healing feeling to each and every one of them. Wish them well on their journey. Each person you know, extend that warm, radiant energy to everybody. The cancer diagnosis in Montreal, then in Quebec, and everybody everywhere. So anybody who's suffering in any way or form, you're like a being of light. You're radiating your healing energy everywhere, healing and sending your love into the world. And recognize that you're doing that, you're sending that warm healing energy to yourself. It's like you're a being of light, and the light is permeating in every direction, healing the tissues, permeating into any of the dark spots, difficult spots, going into your psyche, into the emotions, permeating through the spirit. You're like healing, warm, beautiful being of light, healing yourself naturally as you radiate outwards. So from that deep place of relaxation and peace and love, we're going to do a body scan in turn, alternating between just being mindful of the body parts in turn and sending that warm energy there. So bring to attention your toes. Just in mind's eye, what are the sensations around your big toes and your little toes and all the toes in between? Just watch, experience. And then on the next in-breath or out-breath, imagine that you could send a warm, healing wave of beautiful, healing light right into your toes. And that your toes could kind of release any sense of tension, become very spacious. Bring your attention now to the bottoms of your feet and the top of the feet and the ankle bones. Just be very curious about your feet. And then again, on the next in-breath or out-breath, imagine that you could send that warm, healing energy down to your feet. Sense of gratitude that your feet are connecting with Mother Earth. And allow any sense of tension in your feet to simply be drained on the spot, to simply let go. Bring to mind now your ankles, the middle sides of the ankles, the outer sides of the ankles, all the bones in the ankle joint. And again, send that warm, healing energy into your ankles and into your feet and toes, creating a sense of relaxation, sense of peace. Bring your attention now to your calves, the back of the calves, the sides, the middle calf, the shin bones, the area just in front of the shin bone, your lower leg. Be very curious. And send that warm, healing energy from your heart into your lower legs, relaxing all those muscles. And they become very smooth and soft as your lower legs, ankles, and feet become more and more relaxed. Bring your attention now to your upper legs, the thighs, sides of the thighs, middle thighs, the big bone in the middle, back of the thighs. Be curious, what does that feel like? And again, from that limitless source of healing energy, send that heartfelt, loving kindness right into your thighs and upper legs. Let everything become very soft and smooth, totally relaxing your legs. Let your legs become very, very heavy. Great sense of peace in your mind as your legs become more and more soft. I love myself as I am right now. Bring your attention now to your hips, the sides of the hips, the fronts of the hips, that joint deep in the hip joint, and the buttocks, where that's touching whatever you're sitting or lying on. Be curious, what does that feel like? And again, next in-breath or out-breath, send that warm, healing energy right from your heart, right into the hips and the buttock. And imagine like you're on your butter on a very hot plate. You simply allow the buttock to simply relax, just melt on the spot. And as your legs become more and more relaxed, your mind can become more and more relaxed, sending that wondrous healing energy to yourself. Very nice. Bring your attention now to the bottom of the body, near the genitals and anus, perineum, the deep sacral tissues. This is your root of life. Sacral, strong, living energy. And sending that healing energy, you energize yourself. Will to live, strong, healing energy as you send that warmth from your heart right into the deepest part of the pelvis. Bring your energy now to an attention to your lower back. So lower back to where the arch is in your lower back, and of the bones and of the muscles around the bones. great sense of gratitude for the strength, the solidity of your body. And again, on the next in-breath or out-breath, send that warm, healing energy into your lower back, releasing any sense of tension, just allowing things to expand and become spacious. Very lovely, healing energy in your lower back now. Bring your attention now to your abdomen. Just be very curious. What does that feel like? Lower abdomen, mid-abdomen, upper abdomen, your kidneys at the back, and your liver, and the bowel. Sense of real gratitude, real appreciation that all those organs are working for you 24/7, helping to be nurtured and detoxified, doing all that role. And with that kind of sense of deep gratitude from your heart, send that warm, healing energy into your abdomen. It's like you're really sending that loving energy to yourself. I love myself just as I am right now. This miracle of being facilitated by all the organs in my abdomen. You can come to a greater sense of relaxation, watching the abdomen rise and fall. Bring your attention now to your heart center. And again, we're going to regenerate that sense of peace and love right at the level of the heart. Like a warm, healing energy. You're like a being of light, sunlight, sending that love to the people in your life who are suffering, who are close to you, your loved ones. And as you visualize that, imagine that you're radiating this warm, healing energy in every direction, like your skin pores are opening up, you're like sunshine. And that's core of warmth, of loving energy permeates out from your heart into your lungs. Gratitude for the breath of life, permeating out into the ribs and the muscles around the ribs and the chest area. Really radiant, warm energy into your upper back and bones and muscles, releasing any sense of tension. I love myself as I am right now. Let that radiate outwards. Now imagine that you could extend that warm, healing energy up into your shoulders, like a beautiful waterfall of energy permeating up into your shoulders, and let go of any sort of tension. You take the weight of the world off your shoulders now and just come back home to that deeper sense of peace and love. Very nice. And allow that warm, healing energy to permeate through your upper arms, like a beautiful river of healing, warm energy permeating down into the elbows and relaxing the forearms, and this warmth permeating out into the wrists and the tops of the hands, the palm of the hands, and into the thumb and all of the fingers in turn. This beautiful, warm, healing energy soothing all this tissue, allowing your mind to relax more and more. You're a being of beautiful light, permeating and healing everything that you think of now. Wonderful. And send that warm, healing energy up into your neck, into the throat area now, and to the muscles around the throat. Muscles at the back of your neck and the neck bone, And allow your head to become very heavy so the neck muscles don't have to do anything. Just allowing yourself that deep sense of relaxation, deep sense of peace, and appreciation for your voice and your spirit. And now bring your attention into the lower part of your jaw and around your lips and your cheeks, lower cheeks. And you can raise up your hands now and give yourself like a little massage in your chewing muscle. So just in front of the ears and just lower down a little bit of the muscles of chewing, the masseters. And just give yourself a very nice little massage. Sometimes we clench and hold on. You can just be very kind as you massage with your fingers or your knuckles. And now move your fingers up into the high forehead area and gently, gently just kind of discover, like a blind person coming to know their lover, the contours of your face. So in and around your eyebrows and gently touching your closed eyes and the cheeks. Loving yourself. Who is this beautiful spirit who inhabits that face? You bring your hands back down into a very relaxed, natural position. I love myself as I am right now. You can even have a little yawn if you want. Just allowing yourself to become into very deep and relaxed space. Bring to mind the feelings around your temples now and just above your ears and the back of your head, kind of the crown area, and sending that warm, healing energy to the space around your head and allowing your mind become more and more relaxed. Very nice. And imagine that you could breathe through your top of your head like a whale or a dolphin. And imagine that you could breathe in this universal healing energy. Could be violet or purple, could be a golden energy. And on the in-breath, you breathe that deep down into your body, inviting in the healing, the transformation. On the out-breath, again, breathe out through the top of your head. So you're cleaning your system and releasing and letting go. Breathing in a sense of calm and peace, inviting that into your life, inviting the healing and transformation in your life. On out-breath, breathe out through the top of your head and relax. Release any sense of tension you can let go of. I love myself as I am right now. Can release that visualization now and come back home to heart energy. Bring your attention back to that strong and resilient core energy in your heart, that loving, kind energy in your heart. And you can say an aspiration as you come back home to that deep sense of connection at heart level. You can say to yourself, may I be at peace. May I be free from suffering. May I find a healing pathway. May I come to know my own true nature, the highest level, however you understand that. And at the same time, you can set that aspiration out to other people. You say to yourself, may they be at peace. May they be free from suffering. May they find their path to healing. May they understand their own true nature. Just give that away through that universal transmitter and receptor of love, which is your heart, giving away that good feeling to everybody, everywhere. And come back home again now to Just being in your body. Bring your attention to your feet, connected with the earth, to your hands. Just wiggle your toes a little bit and wiggle your fingers a little bit. And take a deeper breath. Now fold over your arms over your chest and just give yourself like a little hug. So it's an arm hug to start out with. And if it feels right to you, you can bring your knees up or even just one knee up towards your chest and give your knee a hug or your knees a hug. And you want to rock a little bit back and forth. And lastly, if you're lying and you can kind of flop towards your right side down, your left side up, and take a fetal posture. If you're in your chair, you can just slump over a little bit more and get into that kind of comfortable fetal position. Adjust your hands and your neck and your head in a way that allows you to completely relax. Now make a plea to yourself or a promise to yourself that you can bring this sense of relaxation, that sense of peace, that sense of connection into your life more. In the midst of your busy days, or maybe you're on the computer or talking to somebody, maybe on the telephone. Whatever the activity is, you can remember to bring your peace and your resilience and your love into this world. The same kind of state of mind that you're in right now, you can choose to bring that into your life more and more often. More and more often, you can come home and be at peace, express your love. So that finishes off the relaxation piece here. And I would just say, as you kind of start to maybe get up and so on, you want to go very slowly, right? So just, sit first, adjust the blood pressure, slowly get up, use a chair to help yourself up, and you can get back to the computer.
Rob, that was beautiful.
Thank you.
I think that if all of us can just take away that whole idea of being kind to ourselves and being able to practice more self-compassion, it would be a beautiful gift, as you said.
It would be. And there's good science to say if we practice self-compassion, it makes the changes more effective. It's the best way to actually grow spiritually and psychologically. So the self-love, self-care. And, we did this exercise and people can practice that type of exercise, and it gets easier and easier to, activate that in your life in the day-to-day, in the busy day. Yeah.
Beautiful.
Yeah.
So we did get a couple of comments and questions. One of them particularly spoke to the whole notion of acceptance. And one writer wrote that, once she realized that one of the triggers for her was that she kept repeating this message that cancer was taking away from me or stealing my life.
Right.
That's when she made the conscious decision to transition away from that and to start learning to live.
Yes, excellent. So really appreciate that comment. Especially during time of COVID, right? We're like people having to self-isolate, they have a cancer diagnosis and just feel like I'm missing out on my life. So that's a natural thought that comes in. And there's a whole technique of cognitive behavioral therapy, or what I call reframing, where we can watch ourselves think like that and say, well, if I think that way, it makes me feel this way, and I'm just not happier when I kind of focus on that thought. And by reframing to say, yes, this is tough. So it starts out with the self-compassion. Yes, this is tough. And I can choose what's most important. I can make the best out of a difficult situation. I can choose to connect with other people. I can take care of myself, right? And so we want to be both realistic and compassionate towards ourselves as we recognize that we're talking to ourselves in a way that's not helpful.
Okay. Another question that came out, it might be a whole talk unto itself, but is the struggles of somebody who gets a cancer diagnosis and is also diagnosed with depression.
Right.
And how difficult that challenge can be.
Yes. Yes. Yeah.
The question is how can that be?
Yeah. So then so recognize, people come into a cancer diagnosis with their lives, with their personalities, and the cancer diagnosis is an additional stressor. And that's why what we're talking about in terms of self-compassion is, we're not going to do this perfectly. We're not going to make all the right decisions. We're not going to act properly all the time. And so it's really this kind of kindness towards oneself, to find the moments where you're making gains, to find the moments where, you're feeling good, and doing what's right for you. And so, and just the fact that someone would share that question, come to the seminar, I think that by itself shows a real strength of character. And so hats off to that person. And then just from a practical perspective, one of the ways that you can kind of biohack or, trick your brain into feeling happier is actually through movement. And then people will say, well, I don't really like to exercise. So the trick of the day is choose a song that you really like, maybe from your high school days, or just like a fun song that's good for you. And let that be the 3 or 4 minute start to, your exercise routine. And when we do kind of move our bodies, it releases happy hormones that actually change how the brain thinks. It gives us more motivation to connect with other people. And it really is probably one of the best ways to help with depression. So not only does it help with cancer, but it helps with depression. So if we can do that incredibly loving thing to, find a way to exercise, and I hate to use the word exercise, it's like to be physically active or to use movement, et cetera, we can help ourselves. Yeah. Yeah.
Thank you, Rob. That was,
yeah.
I know, a tough question to answer
It
in
is.
in 1.2 minutes, but you did a good job with it. So I just want to end by doing something that I'm a big believer in, and that's gratitude. And expressing our gratitude to you for taking your time. I know it's precious. And coming and sharing your gifts, your loves, your support with us here online today. So what I'd like to do is I'd like to unmute everybody in this group so that they can share their gratitude with you as well.
Thank you, everybody, for coming. Before I unmute everybody, you can also go to our website, healingandcancer.org, and there's a lot of talks and free practices, et cetera, et cetera. So it's another resource for you in addition to the amazing wellness center that you have there. So thanks, Debbie. And I'd love to hear a little chirp in from people as they're leaving now.
All right. Well, here we go, everybody. Chirp in. Thank you, Rob.
Wow. Thank you so much.
You're a sweetheart.
Thank you.
Well, guys.
Thank you.
Take care.
Very informative.
Thank you from Wellspring, Calgary.
Oh, wow. Great to hear from you.
Thanks very much.
Take care. Bless you.
Very informative.
Thank you.
Très intéressant.
Merci beaucoup tout le monde.
Au revoir.
Au revoir.
Thank you so much.
You're welcome.
Thanks a lot.
You're welcome. Bless you.
Merci tout le monde. Je vais te souhaiter une très bonne journée. Thank you, Rob. Until we meet again.
Yeah. Thanks, Debbie. All the best. Bless you. Bye-bye.
You as well.